pretty remarkable day, at least from my perspective. I thought I'd start with just some of the themes that I heard listening throughout the day, and then we'll open it up for some reflections from our panel. And then if there's time, although I don't know if there will be, we may have time for a couple of reflections from all of you. But if not, to Nathan's point, we can feel free to express yourselves on the walls out there or in emails to us. So first of all, we started this morning with a real focus on the healthcare system and the challenges there are just within that one system to do a better job. We had a focus on transparency with the quote that nothing will change until we can see what we're doing, all of us see that, until we stand in the shoes of those that we serve. And that we need to really take the I out of everything we say and use the word we, which I wrote down as well. So transparency, the person in the center, having very specific and perhaps different models of care depending on the population that's being served. Data to measure progress, and anecdotes to go along with the data to enliven that picture that we're painting. A sense of community. And then the words that really resonated as well with me, which aren't so much those hard infrastructure, strategy, policy comments or thoughts, but encouragement, grace, and patience were all kind of spoken throughout the morning and this afternoon, along with humility, learning together, and trust. So I think if I'm going to sit here and think about what I thought we would be talking about at the beginning of the day till now, I think I've really flipped a little bit into more of how important that relationship and the sustainability of our working relationships is with each other, as much as it is the hardcore strategy and data and systems and performance that we also can't get away without. And I guess my visual for the day is the stew that Ron Sims talked about, a great big stew. And maybe we'll have different recipes, but it's the concept that we have to all jump out of our silos and into a pot, I guess, and make a different kind of stew. The other thing he said, or someone said to me today, was it's scary. It's scary to kind of move from where we've been to where we're going. And yet I think today I just started listening for those words. We weren't saying if we could do this. We were all leaning into what we can do together. So I think for me that was pretty awesome in terms of the day and some of those words that we were using to move forward. I also didn't hear, which is actually the first time in the meeting of this crew in Healthcare Washington, I did not hear, well, it's the medical system or it's the community. I heard it's the population we all jointly own and how can we all contribute to that and make the finances and all the other assets that we have work together. I think it's the first time we stopped saying, well, it's only 5% of this and 10% of that, or whatever those percentages are. And in fact, let's all work together to see how the whole can be greater than the sum of the parts, regardless of what those percents are. So this is the first meeting I've heard where it hasn't been that differentiation and the bifurcation of sectors in the ways that I've heard before, but much more that understanding that we're taking care of populations that have individuals within them and the denominator underneath them where we can actually measure our success. So those were kind of some of my reflections for today. Before I go further, I would be remiss if I didn't introduce the panel because, I promised Nathan I would do that before I started. So I'll do it now instead. Right to my left is Diana Burkett-Burkow. She's the Executive VP of Marketing and Public Affairs and also the President of the Group Health Foundation at Group Health Cooperative. Next to her is Winfried Donkey, Executive Director of the Choice Regional Health Network. And next to him is Victor Collymore, the Chief Medical Officer at the Community Health Plan of Washington. And Andrew Ober is to his left. He's the Marketing Vice President, or Market Vice President, I should say, for Regions Blue Shield. And of course, everyone knows Representative Eileen Cody from the Washington State of Representative. She's the one that's going to sing at the end in case you wonder. Okay, so I started kind of just thinking about some of my reflection for today, but I'm really interested in the rest of you and what you all heard today that will help frame those collective priorities moving forward. From this morning until now, how do you see those priorities either staying the same or changing from what we started with today? I'm going to start with Winfried and then Victor, and then we'll have the rest of the panel join in as well.
Yeah, thank you. Great question. We heard a lot of conversation today, and I don't know about you, I took a lot of notes. A number of the themes that emerged, I think you touched upon. To me, I was really encouraged by the fact that, particularly later in the meeting space, we had a conversation about the social determinants of health and health disparities. Am I not up? Thank you. Can you hear me now?
Yes.
There we go. Sorry about that. Just in case you didn't hear everything I said, I was particularly encouraged by the fact that we ended up having a conversation about the social determinants of health and really made the connection between the patient-centered, individual-centered care conversation that we started the day out with, and then making the linkages to the community services and the community overall that we need to connect to. And the choice supports the Cascade Pacific Action Alliance, which is one of the 9 accountable communities of health in the state of Washington, and that's right in the wheelhouse of accountable communities of health. So I was really encouraged that we ended up really dialing in on that critical connection that social determinants of health provide to really the health equity, the broader health equity conversation. And specifically, the emphasis in one of the breakouts was that health equity cannot be an afterthought. This has to be part of the design of our transformation process. We cannot do this. And then there's also health equity. That has to be baked right into the pie.
Victor.
Okay, thank you. Dorothy didn't leave too much after her synopsis, but
I got so copied up before this.
what I heard was a lot of engagement, energy, and enthusiasm about value-based care. I heard about the necessity for integration of behavioral health, addiction medicine. I heard the social determinants of health. And I also heard separately the need for care to be safe, effective, and efficient. And then frankly, I got to thinking, in 2001, the Institute of Medicine basically expressed those same things. And then frankly, I got concerned, we've been expressing it for 15 years. So what's different now? So what I heard as well is that it's now become untenable. 18% of the gross national product. And also, frankly, if you go out to the table there, you'll see the Healthier Washington results on those 55 common measures. And frankly, as a state, we don't have any measure in the top 10 percentile. And in fact, a lot of the measures are in the bottom 25th percentile. So, in addition, I heard, frankly, a little bit of disgruntlement about that. Frankly, that we thought we were better than we were, not just nationally, but obviously in the state. The other reality I heard is that, and one of the things that gets us to this point in time is, for the first time, at least on a state level, we're going to have some incentives, both carrots and sticks, to make the necessary changes. So I'm going to pass it on with that provocative statement to my colleague.
Yeah, I don't know if this is on or not, but I would just say, Dorothy, I thought you started this morning off exactly right with your Carlisle quote in terms of talking about the need for hope and bringing together a room like this with folks that we each play a role in this transformation and finding the solution, and it's going to take all of us coming together, and I don't think you can do that with hope. So I thought that started off just an excellent theme. I would say one of the other things that I took away from today, you talked about it with the transparency, and I think, what I take from that is, I think we can all agree on the critical role that transparency plays, and you look at, there are a lot of transparency offerings out in the market, whether it be on the health plan side or whatnot, but I think that where we need to bridge the gap is that those tools might be there, but the adoption and the engagement on those tools is not where they need to be to drive results. And I think that that's one of the things that I know that I'm excited about, is taking that step from just having those tools there to how do we drive engagement around that. That's going to be through education, it's going to be through champions at the employer, the purchaser level, and it's going to be through benefit design to really encourage that.
Yeah, thanks. A couple of thoughts. So one of the reflections I was having today, about 15 years ago, I was working on Capitol Hill, working on a value-based purchasing bill in Medicare. And at the time, we were having conversations about, well, how do you measure it? And is it process or outcomes? And it was a very, very wonky, very financial conversation. And there's parts of it that still are a very wonky financial conversation, because they have to be. But we've come a long way from focusing just on clinical measures and negotiating, is it outcomes or process, to then integrating patient experience, to now integrating, well, how do you actually measure and target equity and social determinants? And there's some people, like Iris Gupta, who's been working on that for 15, 20 years. But many of us have not worked on that as an integrated whole together. So that's, I think, very hopeful that that's moved forward. Where I think there's still some really gnarly questions to wrestle with is, one, and Doug was sort of pointing to this earlier, who pays? So as things come together and across, and if we're doing value-based care and value-based purchasing, where does the money come from to go back into the system to support the broader social determinants or the intersections of care? Is that the public sector, the private sector, the philanthropic sector, and how do we decide that? And then the second part was, how does that really relate to long-term healthcare costs? And how do we avoid being in a situation where, maybe Eileen can speak to this, where we are not sort of negotiating between, do we fund McCleary or do we cut healthcare? And because they're all related ultimately in terms of overall social well-being, but those are by the nature of budget cycles, those are the conversations we end up in.
What about?
I will say that's exactly what I think, really for this whole room, for us to think about, is that we have good discussions about social determinants of health. I will say that the legislature has actually used those words in the last few years, so that's positive. There's been some changes that we actually are talking that way, but I won't say that everybody has bought into it or that they understand it. And I think McCleary is a great example that if we put all the money in McCleary, which, that's where the courts are kind of pushing us towards, we have to remember how that's going to affect the health. But of course, the McCleary decision in funding education does help health, because it will hopefully get more kids graduating, higher income levels. We know poverty, so there is a tie. But I think all of us in healthcare need to learn how to speak to people about the tie, and to be able to say, you can't do, we have to rise the boats all together. So I think it's a great thing to point out.
So along those lines, I did hear a couple of folks today talk about the deepening of the understanding, really, of social determinants and their relationships to each other, that we've conceptually got the concepts, but now it's, well, what is the impact? Another, transportation, that's also
Health in all policies.
It's health in all policies, but it's Karen Merrick here, or Laura both talked about that right at the beginning of our innovation plan. How do you actually engage at that level with, so people begin to understand how those things interrelate? Okay, well, we've got time for one more question, so I'm going to combine a couple that we talked about and ask you to put your leadership hat on. And from a personal perspective and potentially a broader system perspective, what do you leave here today with in terms of your own leadership passion to carry this work forward, and or what you think we as an overall leadership body need to do to move forward? And let's see, why don't we start here with Andrew, and then we'll end with Eileen.
Sure. Thank you, Brooke. I think one of the things that I took away from today is that there is no silver bullet to solving this, and it's going to take, again, all of us coming together to do that. I think, some of the things that I'm thinking about personally and on behalf of the Regents that we're looking to do. One thing that was striking to me was Dr. Foley's comments about, as a medical student, and just kind of coming to the realization around the payment incentives and 20 years later, but we're still having that conversation. But so coming out of today and working with the HCA, a couple of things that we're focused on are moving more members into value-based arrangements. I think both Dorothy, your comments earlier, and Rick, your comments earlier around that 30% is a great goal to get to. Second is empowering individuals to make better choices around their healthcare. It's giving them actionable data when they need it, giving them the tools to take advantage of that data. A focus on quality, whether that be internally as a system around NCQA accreditation, JD Power rankings, but also in our arrangements with providers and how quality plays into those arrangements and shifting the conversation around from volume to value. And lastly, I would say is individually on behalf of Regents, but then also the folks in this room, around this conversation as we go out from today and takeaways are how do we reach out to what I've heard described to as kind of the watchful waiters, those other organizations that should be a part of this conversation, and us as leaders going out and bringing them in and enabling them to play a role in improving overall outcomes.
Well, I think to sort of follow up on your last point, I still think there are skeptics out there. Not everybody has bought into this concept, and I think one of my tasks as a leader is really to tell them now value-based is not around the corner, it is here. That we are going to have to factor in the social determinants of health. We are going to have to factor in behavioral health, that it's intrinsic, that it's not just going to be the health plans that have to figure out how to move this ball along, but what are you in the clinic going to do to align the incentives of the providers and the staff? What are the hospitals going to do to align to make sure that the quality in those institutions is meeting the test of value? So I think I have to spread the word. I have to think along with them in terms of programs and processes to move the dial forward. Understanding that this is scary for folks. Fee-for-service has always been the mechanism. It's going to be clunky as we transition, but that we have to transition, and just kicking the can down the road is not going to work any longer. So I think our main job at this point in time is to convince, cajole, think of all the things that we can do to reinforce this process. And finally, I would say, I remember a tool as I went through various aspects of management. You can express the change as much as you want, and it's going to get you there 10 to 20% of the time. You can model it, and we've heard examples of various integrated healthcare systems that have been very effective in this. That's going to get you another 10 to 20%. But if you want to hit the home run, you're going to have to reinforce the change. And that is critical issues, the devil's in the details, but unless there's some carrots and sticks, we may be fundamentally kidding ourselves.
So when I think about where do we need to go from here, I'm going to answer this from the perspective of an accountable community of health, because I do think accountable communities of health can be a tremendous transmission vehicle to get to the transformation that we're after. So I think for accountable communities of health, it's really about making this healthcare transformation real so that we get to better health. And how do we do that? By acting, by purposeful discernment of what are the few things that really matter, and to do that discernment within a community conversation. And when I think about that, and then we demonstrate value by doing that, but when I think about that, it's that purposeful community conversation. I think it points also to a different notion of leadership. We often think about a leader as the one person who takes charge and makes things happen. And in the realm that we're talking about here, accountable communities of health, I think leadership is defined, has to be defined differently. It's about collaborative, shared leadership, and it's about how do you facilitate a community conversation that creates the space to have really tough conversations. We just in the adjacent room had a conversation about how do we talk about poverty? How do we talk about racial and ethnic challenges that we have? How do we talk about inequalities? And the logical place for these conversations are the ACHs in our communities. That's what they were built for. And I think that's really what we need to do here is we need to create that safe space to have these really tough conversations through a different kind of leadership. And then also very, very clearly drive towards the results, the outcomes, the actual transformation in the health system that we have. All right.
So maybe just echoing a couple of themes, the driver, I think, of making collaboration possible is that everyone that comes to these issues from different sectors shares a goal of ultimately serving families and people in Washington and beyond. So if that can be the filter, then that's sort of where we come to the table together. And I think healthcare has traditionally tended to impose things on people. So maybe the mental shift that is encouraging, that I know I'll keep taking away, and that I think was present today, was trying to actually do things with communities across Washington and asking the question, because at the end of the day, the consumer, the family, is the one that's paying for it, whether it's through purchasing something or paying taxes, and we're all driven by either a market imperative to have somebody buy what we sell, or the moral or mission imperative to do that, to serve those folks. So to ask, what do folks really need? What are people willing to pay for? And then as we're doing value-based things, do consumers really understand what we're offering, and do they understand the data, and how can we make that more salient and more translatable and more useful in making informed decisions?
Well, thank you. And then, Eileen, what are your final words?
Well, I would say that I came up with an idea for a bill today that I think that I'll work on some legislation that says if you're going to have a day-long conference, that you have to have at least 2 breaks where you can get at least 250 steps in between. Something there, because we were talking about it in the other room. I think that everybody thought we should have a little more action to be able to put around.
Okay, we'll look for that bill and we'll support it.
But no, I think the patient's role in the value-based purchasing is one of the things that I have concern that we really haven't figured that out yet, and that we haven't really addressed that, because they don't know what we're talking about. I mean, when you say value-based purchasing. And I think that when we talk about it, we're usually thinking about the providers and the payers, and forgetting that the patients now are paying a lot more of their healthcare out of pocket than just their insurance premium. So I think we have to figure out a way that they also get brought into this value-based. And I've been trying to float some ideas of, well, what if we, on the co-pays, doing co-insurance, looking at co-insurance rather than co-pays, that's the same co-pay for everybody? Because really, I have concerns that in the substance, our opioid crisis, that we've driven people into choosing opioids over going to physical therapy or acupuncture, because they have to do so many more co-pays to do that, and it's just easier to get a bill. And of course, the pharmaceutical industry has helped along with promoting that. So that's some of the things that I have concerns about that we really have to try and look at. I don't know, I don't have the answers, but that's all you guys out here have great ideas, so I want everybody to think about that. But I guess the reassurance that I'll end with is that we're going to do this, we're going to move forward. The legislature and the governor are behind it. We're not changing, so don't bring bills to try and delay things. I can tell you that right now, because I'll still be there. So that would be, I guess, what I'd wrap up on.
Great. Well, with Representative Cody still being here, that I think is a fantastic end to this entire day. I guess I get to say thank you and safe travels. And Nathan, I didn't hear what you said about, if you get to send something out for comments.
Sure.
So maybe he can just do that final thing, but just, for me, just thank you so much. It's just an absolute joy to work with every single person in here on behalf of the people in Washington.
Let's give him a round of applause. I was remiss in mentioning one other thank you earlier on, and I do want to thank and acknowledge the work of Wilson Strategic, who we contracted with for some of the expertise in putting a conference of this nature together. So wherever they are, in this room or outside of it, thanks to them for that. Next steps-wise, as I mentioned earlier, we will be sending out videos, and we are inviting correspondence from any of you that participated today on more of a plus-delta basis. What did you gain value out of today? What did you not gain value out of? Because I'm sure we'll want to do another gathering like this in the future, and we want it to be a really good use of your time. So thanks again, folks, for coming out, and safe travels to everyone.